Hello, World Wide Web. I'm Dr. Hastings with Balanced Foot and Ankle in Northern Ohio, United States. So we're reading some questions from the internet today, and I'm gonna do my best to answer them. Around 2 months ago, I had a sharp metal tip of a hairdressing comb enter through my big toe and second toe and through the bottom of my left foot. Ouch. It seems to have healed, but she's still dealing with some sharp shooting pain, tingling, and a limp. There's something to be concerned about. Did this not heal properly? Well, the good news is, by the rest of your story, you're not infected, you've healed nicely, and you're doing your regular follow-up with local providers. So you're kind of doing everything right. The good news is it takes time to heal. It's a longer process as time goes on and we get older. There's a reason I feel my workouts from Monday on Thursday. So when you're healing after good trauma called surgery that you asked for, or bad trauma, a comb through your foot, it does take time to remodel that scar tissue and figure things out. Current research suggests 1.5 to 2 years of remodeling that scar tissue. So I would expect 1.5, 2 years of that foot feeling a little different than the others. That's okay, it's a normal process. You should be on the lookout for signs of infection, but I think you're well on your way to recovery. Just a waiting game at this point. Question 2, my foot turns purple for no reason. Uh-oh, that's probably not good. I recently was treated for a 2nd-degree sprain in my left foot after a hike and have been dealing with inflammation, cellulitis, which is a skin infection, some nerve problems. I've been in a boot for around 2.5 months and have an elastic band that keeps my foot in place. So you had an accident after a hike, and now you're dealing with nerve-like pain, I read, and color changes of the skin. So there's something out there called complex regional pain syndrome. This is one of the things that no provider wants to see in their office, and if you think you have a patient with complex regional pain syndrome, you got to jump on it, all right? For mechanisms that are not quite clear, you may have sustained a nerve injury. That nerve controls not just how you feel, the symptoms of pain, but also controls blood flow. So you'll have a cold, purple, or red limb that has muscle atrophy. And you mentioned in your question weakness, you have trouble lifting your foot. So this sounds like complex regional pain syndrome, and there's 3 things I do with my patients immediately. Number 1, vitamin C. Number 2, intense physical therapy, even if it hurts, because you have to keep this foot wanting to be a foot, and a neurology referral. But early intervention is key. Call your local provider, and you can actually use the words. I had an injury, complex regional pain syndrome, pain out of proportion to the stimulus or injury, and color changes of skin with weakness. That's sort of classic.